Hello everyone, myself Dr. Apurba Bezbaruah secured an All India rank of 1074 in Neet PG 24. Today I am going to discuss about how to make concise notes. So let's begin. First of all, why should we make concise notes? Guys, it's very important to revise all 19 subject high yielding points in last 10 days. So it's become very difficult or impossible to revise everything, all high yielding, all important stuff in last 10 days. So to effectively revise all these things, we have to make concise notes. This is a must. Again, who should make concise notes? At this moment of time, you have to ask yourself a question. Can I effectively revise all my notes in last 10 days? You have to ask this question right now. If the answer is yes, only 10% of the student, the answer will be yes. Who are those students? Those students who join DAMS or any other coaching institute in their first or second MBBS itself, and they have revised all their notes multiple times in MBBS days itself. Now their notes become very familiar. They can easily revise everything in last 10 days. They can skip concising their notes. But the vast majority of students, the 90% of students, the answer will be no, because it is too vast. They just can't revise in last 10 days. Even I was one of them. So we all have to do what? Concise our notes so that we can revise in last 10 days very effectively. Now the third question, when? When should we make concise note? Guys, after second read and PYQ, this is ideal time. After doing second read and solving all our PYQ, we have to concise our notes. Why? Because you will know what's important, what high yielding. After doing second read and PYQ only, you will know these are the topic from where maximum number of questions are coming repeatedly. So we have to master this topic and include it in our concise notes. Now the most important question, that is how to make concise note. Guys, all you have read your main notes or rapid revision notes. Now you have to funnel it down and make a concise notes. During this process, many things will go to your subconscious mind, which will come automatically during our exam. What should we include in our concise notes? That is PYT, high yielding points, highly volatile stuff which we tend to forget easily. We have to include all these things in our concise notes. I discussed it previously also. 80% question comes from 30% of topic. This is very important. We have to include this 30% topic in our concise notes so that we can effectively revise. Now the most important thing is identify accurately this 30% of topic. Those students who will identify accurately this 30% of topic and revise it multiple times will get a far better rank. Now for short subject, if done from RR or any short thing, we don't need to concise because short subjects are usually very short. So there is no point of concising it. Now I have included some of my sample notes. Now see, you can use this kind of copy to make your concise notes like this, or you can use this kind of paper also to make concise notes. See here, this is from surgery, that is varicose bleeding stuff. For control of varicose bleeding, various balloons are being used and these are coming in image based question. If there is single balloon and 3 channel, it is Linton tube. If there is 2 balloon, 4 channel Minnesota tube, this is previously asked question. If 3 channel, Sangsten Blackmore tube. Again, difference between duodenal ulcer and gastric ulcer. I tend to forget easily this thing. That is, which one is malignant potential? Gastric ulcer has malignant potential. Which ulcer bleeds, posterior or anterior? Guys, duodenal ulcer most common posterior ulcer bleeds, and it is gastroduodenal artery which bleeds most commonly. Again, for obs and gynae, the treatment of anemia, the clinical question comes from here. It is very important based on gestational age. Again, ADH free T3 T4 hormones remains normal during pregnancy. This is from ortho. You can see different tests and their pathology. For example, MT can test, Beer can test for supraspinatus tendinitis, then Lachman test for cruciates, McMurray-Applis for menisci. Again, anatomical snap box boundary, that is lateral boundary is what? APL and EPB, abductor pollicis longus, extensor pollicis brevis, also constitute dequervent tensosynovitis. So you can integrate things after certain amount of time. Again, this is vaccine. I included in very small stuff. Open vial policy, then diluents, where to inject which vaccine, etc. Heat sensitive, freeze sensitive. Now this you can also concise it like this. For example, pencil cell iron deficiency anemia, sparocyte, degmacyte, drepanocyte, dacrocyte, cystocyte, acanthocyte, echinocyte. All these examples. If you don't revise these things in last 10 days, you will definitely forget it and you will miss your rank. So guys, study smartly, make concise notes and study effectively like this, so that you don't mistake even a single question from this important 30% of topic. Now, if you have done main videos from DAMS, you can use DVT. Why? Because teachers are same teacher giving same lecture. Dipti ma'am will teach from main videos, she will teach you DVT. So there is no sense of source, so you can use DVT. But if you are from different platform like Mero, Prepleather, then you should avoid using DVT. Same case for BTR also. Only BTR, a big no. BTR lacks conceptual knowledge, so only BTR won't help. If you have studied from someone else, then there is no point switching again to BTR and study from same thing from someone else. Your own concise note far better than BTR or any other shortcut. Guys, don't just keep hard work. This is your main notes. You will funnel it down and make short notes. So during this whole process, there are many things which will go to your subconscious mind, and all these things will come automatically to you during your exam. The question that you will guess will come right. How? Only by doing this thing, because in this process most of the thing will go to your subconscious mind. So maximum guess question you will do right only by this way. Again, revise concise note multiple time. This is the main thing, you have to revise it multiple time. Last 3 days, screenshot table images, you have to include it in a folder, and you have to make this kind of folder so that you can easily revise all the important screenshot from here. I will show you how to make this kind of folder. Just a second. You can see all these are important high-yielding screenshot that I made, and you have to revise it just 3 days before exam, or multiple revision you have to do it so that you can revise it effectively. For example, see, this is ABCD2 score. If you just don't revise it before your exam, you will 100% definitely forget everything, all the points. So you have to make this kind of important screenshot, save in your phone or iPad and make a folder. Important images also, AKI, Alvarado score, antiarrhythmic classification, everything. Then for anatomy, you can important images, you can just save important images like brachial plexus, esophagus vein, back muscles, okay, cerebellum, etc. Like for example, this functional division of cerebellum, this is a Mero screenshot, which lobe functions are what. So all these things are very important. You have to revise it just before exam. Do smart study, guys. Only this way you can score very good mark. So at last, I want to say thank you very much. If this video helps, do consider subscribe to my channel, and if you need any help, you can directly message me on my Insta handle. I will be very happy to help. Thank you. Goodbye.